health is wealth. And as we know now, finding things early is or basics. I always check for a PSA to make sure men don't have a risk of prostate cancer. And it depends on the patient's age. So African American men need to be checked earlier, and men with a family history of prostate cancer also need to be checked earlier than the normal age 50, 45, 40, depending on age and family history, as well as men that have a mother with history of breast cancer who are now found in genetic predisposition to prostate cancer. So for prostate in itself, we are really much more proactive. I also, in Quantum Health and Wellness Center, do a more generalized approach to medicine, preventative health. So in all those patients, I'm doing even cardiometabolic risk factors such as CRP, homocysteine, lipoprotein D. You know all of those to just generalized health. But also for men, testosterone is a big thing now. Everybody's hearing it on TV. And so they have questions, but they have to also be careful to make sure they don't have prostate cancer, to be thorough in that evaluation.
You're listening to the Lifestyle Medicine Podcast with Dr. Ivan Rusilko, brought to you by Access Labs, where we explore new perspectives at the forefront of personalized healthcare.
Well, hello and welcome to the Lifestyle Medicine Podcast. Again, I'm your host, Dr. Ivan Rusilko, and we are powered by Access Labs. If your doctor's not checking your labs, then they're not a doctor. And today we have Dr. Hall, who was one of the first female urologists. Yes, it's a very unique thing, so I can't wait to get into her history of why she got into urology of all places. So we're excited to talk about it, as well as her book. So Dr. Hall, thank you so much for stopping by.
Thanks for having me. Really happy to be here.
Heck yes, heck yes. So can you tell me, first and foremost, how did you get into urology?
So when I was a medical student, we were paired up with a mentor, and mine just happened to be the head of urology. And he showed me the great part of medical aspect of urology as well as surgical precision. And so when I was doing dissecting the body, I enjoyed that. And I decided I'll tell my dean, I really want to be in this field. And he's like, he dissuaded me from this male-centric field. And so I refused to listen to that. I found a female urologist, and she's like, follow your dreams. This is your passion. This is what you should do.
I love
And so that is actually how I decided to go into the field of urology, and have enjoyed it ever since. Yes.
So in a male predominated world, how do you feel like you fit in? Like, is it awkward walking into a room with a man there, or is it just you just walk in and own it?
So own it. Confidence is key, and your knowledge and your competence is the other factor. And I never try to fit in. My uniqueness as a feminine component to my being is probably my best quality in regards to care, and as well as precision in surgery. And actually, men sometimes tell me things they won't tell my business partners, because they may be feeling insecure in front of a man and feel more secure in front of a woman, explaining their sexual health or their medical problems or their avoiding dysfunction. And so I think, actually, believe it or not, they're sometimes more comfortable with a woman.
Okay, very, very cool. I'm trying to think how I would feel. I mean, I don't know yet. So, but so let's.
We have small fingers. I have small fingers. So there's a positive there.
Yeah, definitely a pause. You got those like bear paws. You know what I mean? That's good.
Oh, totally.
So definitely. So tell me, when it comes to your approach to urology, what are the most important things when not only diagnosing a patient, but when it comes to formulating an actual treatment plan for them?
So health is wealth. And as we know now, finding things early is or basics. I always check for a PSA to make sure men don't have a risk of prostate cancer. And it depends on the patient's age. So African American men need to be checked earlier, and men with a family history of prostate cancer also need to be checked earlier than the normal age 50, 45, 40, depending on age and family history, as well as men that have a mother with history of breast cancer who are now found in genetic predisposition to prostate cancer. So for prostate in itself, we are really much more proactive. I also, in Quantum Health and Wellness Center, do a more generalized approach to medicine, preventative health. So in all those patients, I'm doing even cardiometabolic risk factors such as CRP, homocysteine, D. You know all of those medical aspect to just generalized health. But also for men, testosterone is a big thing now. Everybody's hearing it on TV. And so they have questions, but they have to also be careful to make sure they don't have prostate cancer, and to be thorough in that evaluation.
So when it comes to that, when it comes to your testing, I think we both use Access Labs. Nice plug.
Yes.
For
Yes.
that, did you have
Yes.
did you have a panel that you kind of use for everyone, or is it like they'll come in, you hear their story, be like, okay, I'm gonna do this, this, and this, or is it kind of like a shotgun approach?
I actually do individualized approach for each person. So if somebody's in their 20s and they really have fatigue, like for instance, my soldiers who come back from Iraq and they are cortisol shot, they've been shot at eating MREs away from family, they often have low testosterone. And sometimes this is not normal in a 20-year-old. This used
Mhm.
to be an old man's disease. So I would usually check heart disease, of course, to make sure
Yep.
that if I'm going to replace testosterone, that I'm not dealing with something else as a cause. Because I actually had one 30-year-old patient of mine when Viagra first came out that wanted that for erections. And I was like, no, you're too young. You shouldn't be having erectile dysfunction at this point because he didn't have social issues and so forth that should be affecting that. And he had LAD that was 90% included. And he was
Oh,
mad because I wouldn't give him the Viagra. And then eventually
my God,
he was so happy because I probably saved his life in the
for
end.
sure.
Yes.
My goodness. So that's also a big point to make is that, when it comes to any type of erectile dysfunction, you have to look at the heart, right? I mean, like that's
Yes.
part of the most important part. That's part of the first thing that men will notice. That's for sure. So,
Yes.
so when somebody
Yes.
walks in like that, are you checking certain heart markers as well? I know you'd mentioned
Yes.
HSCRP and things like that. What else are you checking?
So I check thyroid, I check cortisol, I check sex
Right.
hormones. I also, because sexual performance is sometimes the earliest signs of cardiovascular health. And so even when patients, I talk to them, even with my book, I say sexual health is leading to mental and physical well-being.
Yep.
And so I'll check CRP, homocysteine, apolipoprotein B, complete lipid panel. I'll also check for thyroid to make sure that they're not having decreased libido due to a thyroid dysfunction. And also, I often check just basics. Their
Right.
hemoglobin A1C, maybe they're diabetic, maybe there's a component to insulin resistance. So I will do a whole complete evaluation for CMP and different markers for heart disease.
That's it's unique. So do you find that you check more than the average urologist? Because I mean,
Yes,
I know a
yes,
lot of urologists. My brother, well, he's kind of coming over to to the dark side now. But it's always just like you look at certain things. You know what I mean? Like, so
yes.
do you find yourself checking a lot more than the average one?
Yes. So having been trained by A4M and having been, integrated functional medicine trained now, I actually do a holistic approach to my urology, actually, and overall health in regards to hormones, metabolic dysfunction, metabolic syndrome, as we're finding is a lot of the problems now with people with insulin resistance and obesity, and also checking all the basic heart disease as well as sexual health issues. But also cortisol, a lot of people don't realize how stressed they are and how
Yep.
that really affects their overall health, not just physical, but mental health. And so some of these symptoms are signs of physiologic decline. We don't just want to live longer, we want to live healthy longer. And so that's the mindset I have, I guess.
No, for sure. So when it comes to sexual health, again, because I think I said sexual health is wealth, and in a way,
Yes.
that's kind of pretty much
Yes.
why
Yes.
everybody comes to any doctor. I mean, you take that away, take me away.
Exactly.
When it comes to that, well, what do you think are some of the biggest defining factors? Obviously, there's cardiovascular issues. You think there's a lot more,
You know,
both?
It's 50-50. So I want to rule out the medical aspect first. So I'll always check, hemoglobin hematocrit, make sure they're not at risk for clots if I'm going to start testosterone. I'm also going to check their testosterone level, but the LHF, right, their normal precursors. I'll make sure their prolactin levels are okay.
Yep.
But then the mental component, a lot of our 20-year-olds that are smoking pot lately, because in some states it's legal, they
Uh,
don't realize this may decrease their sperm count or they may affect their infertility issues, right?
mhm.
And so for some of those gentlemen, if they are not yet or needing testosterone, I want to make sure to preserve their sperm function. And so those are some things. But mental component is such a big part.
Yeah.
A lot of guys don't realize that if they're seeing a lot of porn on their phones,
Mhm.
in the old days they'd have to go buy or steal their dad's magazine and hide in the bathroom, Now they're actually on their phones, porn,
Mhm.
lots of I can't say some names of the other companies that
There's a
present
lot of
all
them
of
now.
these things. And then when they see a woman, they are like, well, this is not what I saw on my phone. And then that causes the mental component to erectile dysfunction. There was a study at University of Miami years ago where they evaluated football players that had the national championship coming.
Mhm.
50% when the woman naked walked by, they actually had normal erections. And the other 50 that were so concentrated on the game, they couldn't. And that's totally physiological in regards to mental component. Yeah.
That's super unique. And again, you get a big, and it was funny because we were chatting earlier about how my brother just did a podcast on sexual health, which is kind of unique. And one of the
Yes.
biggest things that they had touched on that. So I would love your point of view is how men, when they masturbate now, it's a much different feeling than when you're actually having sex. So the ability
Yes.
actually ejaculates two different things. One's a
Yes.
hand going fast, one's dry, one's
Yes.
this, one that's, one the other. What are your thoughts on that? Actually, I think my brother called it the death grip, if I remember.
And actually, the way I describe it is point and shoot. So
Okay.
point is to get an erection, right? So that's parasympathetic nerves.
Mhm.
And shoot is sympathetic nerves, which is actually the ejaculation. And actually, in my book, How to Get Ahead, I describe how delaying ejaculation can actually heighten your sexual performance and can actually, as David Data wrote about waiting for that elevation to get to a higher feeling of well-being and being in an egoless state and pleasuring your partner is a huge component
Yeah.
to erectile function,
No,
right? Not dysfunction, but actually
exactly.
function.
No,
Yes.
for sure. And what are your thoughts on the readily available pornography as well as how extreme it's become? Back in the day, when you used the
Yes.
soft core, then it's gone to
Right.
hardcore, then it's taboo, then it's just like you're seeing things you've never. I mean, even like Michael Bay couldn't dream up. You know what I mean? Like, do you think like the more crazy porn gets, the worse it
Crazy.
becomes sexually?
I think so because The Godfather was actually written in 1969.
Mhm.
No coincidence there. Actually
I like
brought
you.
like that, brought the penis into pop culture really and started people getting a little bit more comfortable. Now it's so prevalent that some people create this taboo aspect of it, but it's a normal part of your anatomy as a man, normal part of our anatomy as women, or physical well-being, right? How things look, how they perform, and how you feel about yourself. But the problem is when you see porn that has an exaggerated experience, and that's not what you get from your partner, then you feel like maybe you're doing something wrong
Mhm.
or you don't really know. But I think talking about it is key. I think communication is such an important part of, lovemaking. And
Yep.
then also, your love language. So suppose somebody likes hard touch, like to be grabbed hard.
Yeah.
And then you're doing soft, you may be wasting your time. And
Yep.
maybe you should be educated on what somebody else likes or tell your partner what you are liking about certain things because they could be doing something wrong all along.
No,
And
very.
then we're not syncing. So the graphic porn that's out there, maybe educational, but that's why I wrote my book, How to Get Ahead.
I
No
love.
plug there to educate people on some things they may be afraid to ask the doctor. There's so many people, as I said before, may be afraid to ask another male, hey, how am I not getting an erection? What am I not doing right? Sometimes they may not know behind the scrotum to the anus in the perineum, that's a stimulating area because it has nerves that also stimulate the prostate or stimulate the nerves that go to the penis. So those are things that you may see on porn, but not know why that works better. And
Yeah.
so educating people about the anatomy, I think, is key.
Now, did you see educating men and maybe women sometimes too about how like
Yes.
they need to have that? There's an emotional aspect being like, yes, your testosterone, fine, we can bump it a
Yes.
little bit, but you need to tell your partner you like this kind of sex. You know what I mean? Like,
Yes.
do you see there's like
Yes.
that therapy aspect in your practice?
Yes. And I actually, at Quantum Health and Wellness Center, I really try to pull out from patients what their desires are, because sometimes they're really afraid to say it. So you kind of have to bring it up
Yeah,
so for them to feel comfortable. Because as a physician, one of the main things we're checking their most vulnerable parts, body parts, as a urologist.
Mhm.
So you have to get people to trust you and to create comfort. And I try to exemplify that for them in their personal relationship. Trust is such an important part because if somebody's been abused and you never address the issue, they may never be feeling comfortable to share certain things with you and to be able to trust. So I really try to bring up that component, which is sometimes affects cortisol, which then therefore affects testosterone. So it's really a whole body approach to medicine, mind, body, soul,
Yeah, no,
when
makes
I
yeah.
try to address it.
Yeah, I couldn't. That's one thing doctors don't really realize this day as
No.
a whole. Mentality,
Yes.
physicality, emotionality equals great sexuality.
Yes.
It's a
Yeah,
situation.
I like that. Yes.
All right. I mean, it's true. It's true. I mean, the proof's in the pudding.
Yes.
But when it comes to that, so it's kind of unique. I'm curious to see if you saw any correlations. Do you see somebody who comes to your office, they're in good shape, they have a very high testosterone yet erectile dysfunction? Are you seeing
Yes.
that when it comes? It's obviously going to be something psychosomatic. It seems.
Yes.
Do you see that their sexual preference is more of a hard touch, more of an extreme aspect, versus somebody who comes in who has sexual dysfunction with lower testosterone? They're more of a soft. I'm not going to say beta male, but more loving in a way.
So everyone has a different level of their experience. So I try to help find out what is that? Do I need to send them to a sex therapist, right? Or do I need to send them to a psychologist? Maybe it's something they hadn't dealt with as an experience from childhood that may be prolonged now. Or they may want a firm touch and they didn't tell their partner, or their
Yeah.
partner's not comfortable with that. Or they want a soft touch because their testosterone's low. And yes, when men's estrogens are high, they get more emotional than
Mhm.
us women. And I can say that as a woman, that we get moody when
Uh,
our estrogens are high, and men even get more moody. And I think even trans men that are
mhm.
getting estrogen, they don't deal as well, very well, with this estrogen load because their bodies aren't used to it. And sometimes that can create a whole different negative aspect of their emotional state. And
Yeah.
so that's a touchy subject. I don't usually go there very much, but I sometimes try to see if that's an issue for
Mhm.
somebody to deal with, you know. But low testosterone oftentimes may be also due to high estrogen,
Yeah.
and our estrogen rich foods that we're exposed to, things in our diet that may causing us to have increased estrogen production,
Yep.
such as being overweight. And, every 10 pounds you lose, you gain penile length. So that is
Damn, I didn't know
encouraging enough to lose weight.
that. You always learn something in this industry, don't you?
Yes, you do. As a urologist, we look at all the aspects. But I think that emotional component to the sexual function,
Mhm.
it needs to be addressed on all levels, not just laboratory, but social, what's going on in their personal life. Yes.
So I'm also curious too, because the biggest thing you always hear about, if you're going to go on testosterone therapy, watch out for the prostate. And I do know
Yes.
some urologists, they'll do all the checkups and say, yeah, your prostate might be 4.5. Everything else
Yes.
looks perfectly fine. Maybe BPH. We're still going to give you testosterone anyway. And then I talk to other urologists who are just like, absolutely not. I don't care about their sexual health, how they feel. Where do you like which part of the fence are you on when it comes to that?
Both sides. So I will be thorough and make sure that I'm not worried about prostate cancer first before I'll give someone testosterone,
Yeah.
especially family history. So, if their PSAs have been steady, they haven't had increased velocity of more than zero point 0.4 per year, even though a lot of the AUA guidelines are saying that's not as significant anymore.
Uh-huh.
But in regards to making sure that testosterone before you replace it, making sure somebody doesn't have a strong family history of prostate cancer is key.
Mhm.
Now, I've had patients who I've personally taken out their prostate, had a history of prostate cancer, and 5 years after no evidence of biochemical recurrence, I've given testosterone because one, I knew what was there before,
Yep.
what I operated on. I knew their grade of the tumor. I know how extensive their tumor was, and I know that they've been in a steady state, that I feel safe because guys can feel horrible
Yep.
when they have low testosterone and have no energy.
Yeah.
So you have to have a good balance. But there's a lot of data now showing that testosterone replacement helps to reduce coronary artery disease, right?
Mhm.
So heart disease, if you die from heart attack, so what if you have prostate cancer because you died
Exactly.
from something else? But not to minimize it, but
Yeah.
you know what I mean? So
Mhm.
you want to have a good balance, but that's why you have to be educated about the testosterone. That's testosterone research that's been done on people that have prostate cancer. I actually have a patient currently who has been treated with radiation therapy for prostate cancer, PSA horrible, amazingly low for quite some time, testosterone tank lower than mine, which is crazy for a man, and have to replace his testosterone because he feels so bad he can't
Yeah.
possibly exist. But I'm a urologist. I'm going to follow up closely. I'm going to make sure that we're doing all the right things. If I see a PSA rising, I'll check certain things. But, guys used to be worried about the finger exam, but now we have MRIs that are much more detail oriented. The MRI can tell us more, even without having a biopsy or a rectal exam, right?
For sure, for sure. And I'm curious,
Yeah.
can you expand on what, total PSA versus free PSA versus percent? Could you kind of like break that down?
Yes, total PSA is the baseline PSA that we follow in AUA guidelines. Now, free PSA tells us how much is around, right? And the percentage, whenever it's the opposite. If a percent is high, that's a lower risk of prostate cancer. If the PSA total is low, that's a lower risk. So it's antithesis of what you think. So when we look as urologists at percent free, we're looking at a more specific and a little bit more sensitive testing than just the PSA total.
Okay. Is there a reason we wouldn't just test percent and they just say nuts the total P or a PSA, or is it just is it a price thing? Is it a insurance thing?
Pricing is one.
Okay.
Pricing is one, and then insurance is the other. Of course, probably not
Yeah.
covered.
Uh-huh.
That's a whole nother ball game.
Yeah, exactly.
But some people will pay for it if they know the value. And so I will give them the option if I don't get all the information I needed to be able to do a percent free versus a total PSA. I like to always get both, total free and the percent
Yeah, I
free
think
because it gives me more information.
yeah, no, for sure. And again, it's a
Yes.
shame, like, just one extra test and it go from like $2 to like $30. It's just, I mean,
Yes.
it's nuts, but
It's
that's a whole,
crazy.
that's a whole nother podcast.
Yes.
And you actually touched on something very interesting, the thyroid. Because again, a lot of people tuning in are going to hear, see you and be like, why are they talking about the thyroid? Can you, I mean, I know exactly where you're going with this, but could you dive in as to why the thyroid is so pivotal when it comes to male sexual health?
Yes. So I like to describe, because most people know cars. So I like to describe the thyroid as the engine.
Okay.
And thyroid supplements such as zinc, selenium, iron, and iodine are the oil. So that you may need an engine oil change and not a whole new engine. So that's how I describe thyroid. Cortisol is the gas in the tank, which cortisol can steal all of your, they can cause autoimmune disorders, thyroid disorders, diabetes, cancers,
Yep.
infections, right? And then your sex hormones are the tires. And so if we
Good.
get new tires, meaning we replace testosterone and estrogen, but we only have a half a tank of gas, meaning our cortisol, we're getting massage, we're working out,
Yep.
we're praying, we have meditation, but our engine oil is dirty, which is the thyroid. The
Yep.
car isn't going to go very far. And so that's my complete assessment in regards to fixing our tires, which is the testosterone, regulating the gas in the tank, which is cortisol, and then regulating thyroid. Now, what does thyroid present with? Fatigue, decreased libido. It presents with, hair loss.
Yep.
It presents with so many cold extremities. And a lot of people have a lot of thyroid issues for years and are underdiagnosed because they're not checking free T3 and we're not checking reverse T3. And we need to check. Most of the times in general medicine, we just check T or they just check T4 and they don't really realize people are making inactive thyroid and not converting to active.
No, for sure, for sure. If you had to guess, how many urological patients across the nation could be fixed in a lot more holistic way versus what's being done now? I mean, like, again, it's just point and shoot, like you were saying earlier, but there's so much more that goes into that
So
call.
much more. So much more. I think that some people are just band-aiding or getting new tires, but not fixing their engine, And so they may feel better, but not really good. It's when all the parts are working together. It's like a three-legged chair. You're not going to survive on two legs. You really need all three to be working. So I would think that probably 80% of our patients really aren't getting the complete evaluation and need to see an integrative functional medicine doctor like myself or you.
I think it's great.
Yeah.
Again. So I want to touch on your book. At first, I thought it said how to get head. I'm like, wow, this could be a great interview with the urologist, but it's how to get ahead. All right, ahead, not head.
Yes.
Explain, like, how unique the book is because you're coming at urology from a completely 180 different point of view here as a woman. So could you kind of
Yes.
highlight, your travels throughout the book and kind of how, what actually goes on inside of it?
So people think getting ahead is about making money and status, but really I define it as staying ahead of our physiologic decline. So one of the reasons I wrote this book was not just to educate people about blowjobs, which is a major component in the book, about sexual pleasure, but how it affects our mental and physical state. And how I start out with just educating people about why, as a urologist, I wanted to write this book to people that may be afraid to talk to their physicians. I brought in the anatomy and the physiology and the history of fellatio and how this was revered in ancient Rome and in Greece. And, they wore togas so you could get in easily, right? And easy access.
I'm
And when I went to
You got me wanting to buy a toga now. Goodness. I'm going
Yes.
here.
And then Pompeii, when I went to Pompeii, all these statues of men, and you saw signs of people being able to give blowjobs because some women don't realize that this is pleasurable to a man and that before the wedding cake, they may do that. But then after the wedding cake, no. Well, I
You're gonna make
wanted
a lot of
to.
women mad here. You make a lot of men happy and a lot of you very playing to your audience. I love it.
Well, I do also have a chapter on women and about fellatio, but also about cunnilingus and how that's pleasurable to us because the penis and the clitoris are analogous. The structure is the same. The penis does have two functions, to urinate and to get an erection, where the clitoris is just for pleasure.
Yep.
So I did compare the two, and I wanted people to understand if somebody's been through trauma, that was the next chapter, how to get beyond trauma to being able to love and feel good again, physical well-being. And then, of course, 50 Ways to Blow Your Lover is how I ended the book. And
Fantastic. I'm not going to lie.
yeah,
Okay. Very, very good. No, I'm curious. So my first talk at the A4M, I think I said I'm the youngest person ever talk. I think I was 26 at the time.
Yeah.
The speech was called "The 7 Different Ways to Make a Woman Smile." The 7 different physiological orgasms a woman can have. And again, they're all medically sound and everything like that. Can men
Yes.
only have one type of orgasm, or are there other types of orgasms men can have?
So there are different types of orgasms in regards
Okay, here we
to
go. Good.
yes, in regards to delaying ejaculation, because as Debbie Data, I wrote in my book, How to Get Ahead is not just getting ahead of the ejaculation, because it's getting to that finite level of nirvana where you feel so stimulated that you're enjoying yourself, but you're also pleasing someone else. And it's better to give than to receive. You see how much pleasure you get. Some women don't even realize they may get more wet or moist from giving a blowjob because the pleasure they're giving their spouse or their partner is immeasurable for them. And they may have always had a negative impact or a negative thought process. And this was to try to give that information about men get different levels of enjoyment through different levels of pleasure, whether they're perineal access, which is towards the prostate. And of course, I explained this, but not that I'm well versed at it. Even by doing a rectal exam, stimulating the prostate where the nerves run along to the penis is very stimulating to some people. And that's why it may be orgasmic for even gay men to have that area stimulated. And some people don't realize that's another pleasure spot, or the perineum, or right underneath the head where the frenulum is. That can get you into another state of stimulation, which is not just, ejaculation. So
Point and click. Oh my goodness, that's good. Well, I got to say, this has been spirited. And at the end of every one of my chats, I always like to ask my guests 2 questions. First and foremost, I have to change it up a little bit for you because you were fun. For any other budding urologist out there, anybody in the actual medical field, I love your overall holistic aspect. And again, I throw the word holistic around very generally because it's been bastardized in so many different ways. But the fact that you aren't only looking at the prostate or this, that you're looking at thyroid and this, that, and the other. If you were going to give advice to any physician or healthcare practitioner who's getting into this functional field right now, since you've done it so well, what's the best piece of advice you could kind of lend them?
I would say you have to look at the whole patient, not just one body part. And the whole patient is, we're in our physiologic decline from the exposures to toxins daily to our food that has chemicals in them that create a decline in our physiology. We need to not just focus on just what we've learned in medical school, but open our ears and eyes up to what else is research being going on in regards to functional and preventative health. And, what are we not knowing that we've just done reactive medicine? Maybe we should look at the whole approach to medicine and think about mental, physical component, as well as even sexual health. That's a big one now because people are realizing how impacting it is in their personal relationship, but then also their work relationship. If you're happy and you're sexually happy, if there's underwear on the ground, you may not get so mad. If somebody dropped their stuff on. So, learning about what you can do for your patients to improve their mental and physical well-being, I think is the key goal. And health is wealth, and happiness is the new rich.
I love that. I love that. Question number 2, and I'm gonna keep it more towards urology. So if you're a man or the wife of a man or the boyfriend of a man, we're gonna go all aspects here, and you know that your husband, your spouse, your partner, whatever you want to call it, is not having the best sexual experience. What are some of tips or tricks you can kind of give that person who's looking for it, or that person who's looking for it for someone, to kind of take their sexual health to the basically to the next level?
I think first they have to rule out having a physiologic problem.
Love
So you want to check labs, and you want to, through Access Labs, they have many different options for us in regards to testosterone, PSA, of course, or normal cardiovascular health. We also want to make sure that we're checking the patient on a whole. Is it mental, physical? If so, refer them to a psychologist, psychiatrist. But then learning your anatomy. I think many men don't even know their own anatomy. They don't even know that under the head of their penis is more sensitive. So learning a little bit about your anatomy, but also your physiology. The physiology is a component that needs to be addressed to make your whole sexual experience improved. And then your partner, communication. Communication is key. If your partner doesn't know what you like, you may be spending your whole life doing the wrong thing and not pleasing your partner and yourself.
I love that. No, very, very true. Dr. Hall, I got to say, this has been more than enjoyable. For anybody out there who would like to get a hold of you or you'll find your book, where can they find you?
Yes.
Where can they buy your book?
So my book, How to Get Ahead, is on Amazon and it's at Barnes and Nobles. But also, my business is Quantum Health and Wellness Center, where we do mind, body, and soul whole approach to medicine. Also, as a urologist, I do consultations in regards to prostate cancer in general and BPH. And most of my patients really enjoy learning from the book, actually, their anatomy, their physiology, and then about urology itself. And some people are not getting enough time with their doctors because we're so time limited with insurance companies, turning over, that sometimes they need more education. And I'm here to basically go in. I spend an hour with patients explaining everything in detail,
Love it.
answering questions, and going over everything. So our email, quantumhealthmhk@gmail.com, or Quantum Health is the website. And our number, 785-236-1693.
And what about
Dr.
social?
Hall.
You got some socials?
Yes, I'm on Facebook and Instagram at Sulin_Hall_MD, or Quantum Health and Wellness Center. Sorry, I had to think for a minute there. And How to Get Ahead book actually is also on Instagram. And
I love it. I mean,
my website.
all I know is I think I need that book, and I think I need to invest in some togas. I'm not going
Oh
to lie.
yeah, I got to personally sign that for you.
Exactly. Well, Dr. Hall, it's been such a pleasure. Again, this is the Lifestyle Medicine Podcast. We're powered by Access Labs. If your doctor's not checking your labs, they're not a doctor. It's been a spirited discussion today. We might have to have a round two. I'm not going to lie. So maybe we set that up later.
Definitely.
But
I
again,
would love
Dr.
that.
Hall, thank you so much for stopping by.
Thank you for having me. Appreciate you.
Thanks for joining us today on the Lifestyle Medicine Podcast. At Access Labs, every innovation we pursue is driven by one bold purpose: making personalized medicine more practical and accessible for patients and providers. If this episode sparked new ideas or challenged how you think about patient care, awesome. Follow the show and share it with a colleague who's ready to level up their practice. Head over to our website at accesslabs.com and register your practitioner account today. You'll get access to over 1,000 routine and advanced biomarkers with 24-hour results. When signing up, select Lifestyle Medicine Podcast as how you heard about us and score 10% off your first invoice. Oh, and don't forget, drop us a review. It helps more practitioners like you find us. We'll see you next time.